The official commemoration for World TB Day, as well as the launch of the National Strategic Plan for HIV and STIs for 2023-2028, will take place tomorrow in the Northwest. Proceedings will be led by Deputy President Paul Mashatile, who's also the South African National AIDS Council chairperson. Let's speak about this now with Sanac CEO, Dr. Thembisile Xulu. Doctor, very good evening to you. Thank you so much for your time. So these two issues which I just highlighted are right at the top, aren't they, of the Deputy President's in-tray. Put in context to the people who are just catching up with this, why tomorrow is such a significant day.
Okay, good evening, Thembisile, and good evening to your viewers. Thank you for having me. Tomorrow is an important day, one, because it is World TB Day, but it's a special one for South Africa because the Deputy President, in his capacity as the chairperson of Sanac, is also launching the National Strategic Plan for HIV, TB and STIs for 2023 to 2028. You will know, Thembisile, that this is our last National Strategic Plan before Agenda 2030. And we aim to eliminate HIV, TB, and STIs as public health threats by 2030. So failure is not an option. It's said that in South Africa, TB is still the #1 killer of people living with HIV, and it is a curable disease. So it's important that we bring it back on the agenda, that we implement the TB recovery plans, because we are finding that there are a lot of missing TB patients, which means that these patients continue to spread TB, but at the same time that they become prone to developing drug-resistant TB. Therefore, we need to give them access to prevention treatment without stigma and discrimination. But where there's HIV-TB co-infection, we are able to treat the TB and HIV so we can conquer in terms of our local and global commitments.
How prevalent is TB and HIV co-infection, and what are the treatment complications for someone who's battling illness at with that combination, excuse me?
All right, thank you so much. So the WHO, when they looked at the 2021 data, actually found that South Africa has just over 300,000 people that have got TB. Of those, more than 53% have got HIV. So that means we've got a 53% rate of TB-HIV co-infection. Now, you can imagine, Thembisile, that the TB medication on its own has got side effects, which could include, many issues, even renal or even kidneys. But at the same time, antiretrovirals also have got their own side effects. So we need to be very careful in terms of the treatment regimens that we select when our clients are HIV-TB co-infected. But at the same time, we need to work with the patients and inform them and empower them, because this National Strategic Plan is very people-centered and community-centered. And it's one way our patients are not just recipients of services, but are partners.
There was also concern in the 2 years, especially when we were going in and out of the various stages of the COVID-related lockdowns, and hospitals had been shut down essentially, where the priority was dealing with people who were sick with COVID. A lot of TB patients at that time had either stopped taking their medication or had an interruption to their treatment. And there was going to be a catch-up program that was going to be prioritized by government. How much progress has that program made?
All right, so that program we are currently implementing as the TB recovery plan, as well as the catch-up plans. And some of the interventions that we are putting in place is targeted universal testing for TB, where even if you don't have symptoms, if you've had TB before, and maybe you are diabetic, which means you could be immunocompromised, we actually do test you for TB. For people living with HIV, we know that asking the classical screening questions actually does not pick up the TB. So there's a urine dipsticks test that we do called the urine LAM, and that has a higher chance of picking up the TB. One of the most successful things that we've done in partnership with the private sector is to take the digital X-ray trucks into communities and actually get X-rays done at community level. We use artificial intelligence to read these X-rays, and the X-rays then give us the likelihood of somebody having TB. And from there, we do a sputum test, and we can then start treatment without people having to come to facilities, because there are still issues of stigma and discrimination.
And why is TB still one of the leading causes of sickness and death in South Africa when you consider the years of knowledge around its treatment, detection, as well as the massive public campaigns that have been spearheaded from even when we're dealing with the extremely drug-resistant strain and all the work gone into the subsequent years? Why is it still such a major healthcare problem?
Thank you so much. I think I mentioned initially that South Africa has got a high burden also in terms of HIV. We have got one of the highest numbers of people living with HIV. And therefore, when they get infected with TB, it's then co-infection, and that means there is more of a strain on the immune system. And we are finding, as I said, that out of the 304,000 that I mentioned, about we've got a 62% detection rate. So we've got a good 116,000 or so that have not come forward for treatment. So we've got a lot of missing TB cases that just never get onto treatment. And these are the people that, unfortunately, we lose. We've got a high number of losses to follow up. And we find that men actually are 1.6 times more likely to get TB than women because of low health-seeking behavior. And in that instance, if, for instance, it's a man who works in a mine, the mining environment, because of the exposure to silica dust actually makes him more prone to get TB. If he's in a mining environment like Rustenburg for a short period, he might be treated for a short time, but end up going home and continue to transmit, and then it just keeps on spreading in that particular way.
And there is, in fact, the goal to basically a commitment globally to end AIDS by the year 2030. That's in about 7 years from now. Is it still a realistic and achievable target?
I think when we look at the fact that when you look at Sanac's role, we are a multi-sectoral coordinator. It's clear, Thembisile, that government cannot do this alone. Hence, I was explaining about the partnership that we do have with the public sector. We saw with COVID, when we put together public and private resources, some of the successes that we had around COVID. So we need the civil society to be working at community level, increasing education and awareness, the private sector to come in and even offer some of the facilities that they have built, for their mines or for their employees, in order to assist the public sector so that working together, we can then make sure that we achieve our goals. But more than anything, this year's theme is, yes, you and I can end TB, because we are saying ultimately it's your responsibility as an individual to hold your health in your hands. We all have an individual responsibility towards that national collective of making sure that we end HIV, TB, and STIs as public health threats by 2030.
Dr. Xulu, good to speak to you. Dr. Thembisile Xulu, CEO of Sanac, speaking to us ahead of World TB Day tomorrow. Thank you, Doctor.